was in nursing informatics. I brought up computerized provider order entry at our facility. So all of our doctors, instead of writing the chart, they are now entering orders electronically in the computer.
Ah, bringing in news. Well, what is nursing informatics?
Nursing informatics is a new and upcoming different avenue in nursing. We basically use evidence-based medicine to provide the physicians with the tools that they need to be able to utilize the computer more. So in healthcare, there are quality initiatives, core measures, all those different things that we're trying to have positive outcomes. We utilize technology to try to assist the providers.
You guys are busy.
Very, very busy.
You're a busy hospital. I've worked over there.
350 beds, 90,000 visits in the emergency room annually. It's a level 3 trauma center. We're very, very busy.
About your mom.
Yes.
Your mom is an RN, correct?
My mom's a registered nurse. She has been nursing for the past 43 years.
43 years.
In January will be her very last shift. She's going to retire in January.
Completely retired.
Completely retire.
Wow.
That's my mom. I have an older brother who's a trauma surgeon. He works in Arizona.
Oh, okay.
I have a sister who's a pharmacist who's also in Arizona, and then a younger brother who's a lawyer. So we all need some little assistance.
There you go.
With a family full of healthcare professionals, you always need a lawyer.
What an impressive, successful, awesome story.
You know, I always wanted to do something in healthcare. I never really was interested in practicing medicine, although sometimes I think about it every once in a while now.
Hey.
But just, I wanted to, I had some compassion. Definitely my mom was an influence. She always had positive things to say about nursing. So it was kind of a natural progression for me. I think it holds true for many people that you kind of just go to college, you want to get a degree, you want to get a job, you want to make money, just the natural course of life. But after a while you realize that these people you're taking care of are real people with real lives and families, and could be your very own family. And so afterwards, I think as each individual interaction happens, as we're providing care, it makes all the difference. And even now that I'm away from the bedside, I know that what I'm doing is helping people, patients on the back end, and so it makes it work. There's so many avenues in nursing and healthcare in general, but in nursing specifically, I mean, from school nursing to informatics to administration, which I'm getting a master's in nursing administration, hopefully. But just a million places you can work, so many different ways you can help people. So.
What do they need to start doing? What do they need to start studying? What do they need to start preparing for?
I think that definitely taking their their CPR, their ACLS. Anytime a candidate comes to the emergency room, it always puts them a step above if they have these certifications beforehand, because that they're applying themselves when they don't have to be.
Sure.
Besides that, a good resume is important. You have to stand out amongst the other, tens of other resumes that come in.
Sure.
I think things that you do for the community, just things to make yourself stand out. You have to be well spoken. You have to, your appearance is important, and a go-getter nowadays, because it's important. Back when I graduated from nursing, it was always, we can't hire you because you don't have any nursing experience.
Sure.
Now at Bayshore and many other facilities around town, they're hiring new grads, willing to give 16-week internships, lots of experience. But I think the applicant needs to really beef up their resume beforehand, before they even start to apply at the hospital. I think that nursing skills you can teach pretty much to any modality in the hospital. So critical thinking is important, and it's difficult to teach critical thinking because how do you really do that?
Sure.
I think
you can't teach experience.
You can't teach experience, but a lot of scenarios, you are the nurse taking care of this patient, X, Y, and Z is going on, what do you do? I know when I was in nursing school, we read a lot of material and we took tests to determine whether or not we successfully retained that material. And I don't know that that is the best way to teach how to be a good nurse.
Totally agree with you.
It's important for me, everything I learned was about, I have particular memory about X patient, what happened with this patient, what could I have done differently, and so I think that's those types, the same thing that's, the AHA, the same types of scenarios that you have this patient who has these symptoms, what are you going to do for them?
Right.
Because at the end of the day, it's important to have the knowledge about disease processes and these types of things, but in the heat of the moment, when the patient's counting on you to know what you're supposed to do, that type of experience I don't think we learn in nursing school. It's important, I think, to have a good orientation, to have a preceptor who is a designated and educated preceptor, to really, somebody who takes to heart and says, this nurse is going to take care of people one day, so I need to teach them everything that I know. I was lucky enough to have a 16-week internship in the emergency room when I started at Memorial Hermann, but the things that I learned during that time were basics that you didn't learn in nursing school. What do you document? Like, what do I need to write down? What is pertinent information to write down about this patient? And I remember my preceptor, she showed me and said, this is how the opening note needs to be. And back then we did paper. With the computer now, it's nice because it prompts you to say patient appears.
Sure. Kind of does the thinking for you.
Right. At Bayshore, we have invested in a preceptorship program, and they've noticed many improvements. Our retention, because you get a nurse, you come in, and they want to get 1 year of experience and leave Bayshore. We've invested a ton of money in them, a ton of orientation hours, a ton of education hours, and then they leave. So we kind of went back to the drawing board and said, maybe these people are leaving because they didn't get a proper orientation, because they feel like they could do better in the medical center. So we really had to come back and put our brains together and realize, we need to invest in them. It's an asset of the company, and we started to do that. We've been noticing a lot of improvement.
Oh, that's excellent. That's excellent. Well, I tell you, that's got to be a huge stress from a human resources perspective. It's like a nurse gets that one, because that's the big number. All nurses know you got to get that 1 year experience, and once you have that, then you can write your ticket. Right. So I say, man, that's got to be tough on the other end, because
very expensive.
Because if they just look at it straight salary, what you would pay a nurse for a year, that's not the cost.
That's not the cost.
There is the training side to that. You can almost double that cost. Right. So you're going to experience losses as a hospital, and so with that turnover. So obviously you can incentivize them to stay, but I don't think just throwing crazy amounts of benefits if somebody's going to do that. I think it's if they're happy, they'll stay, and if they feel like they're making an impact, they're going to stay. That's what I find. You see people who work at one company for 30 years, and how you get them.
My mom.
Exactly.
Perfect example.
Absolutely. And that's important. They have to be happy. They have to feel that their presence there is positive and wanted. Right. That they're not just another nurse. They're not just someone clocking in and going home. And when you can experience that, that's at least my take on it. All the people who work with me so far, most everybody's been with me since we started. Right. So 4 years. We've been open for 4 years, and most of the same faces for 4 years. Great. We've hired some more people here and there. Some people come and gone, but for the most part, it's the same faces for 4 years.
Volumes about where you are. I've been at Bayshore, between East Houston and Bayshore for the past 6 or 7 years, and it truly is, are you improving yourself every day? Are there opportunities for improvement and growth? Those are the type of things that you turn around and you look and you say, is this place benefiting me? I'm working hard to make this place better, but is it benefiting me? And I think if the answer to that question is yes, I work under a great chief nursing officer, our CEO's, excellent, just great leadership. I couldn't ask really for anything more. It would just take forever to look through a chart to find one thing that you're looking for. Now in the computer system, it's very easy for the provider to look for a CAT scan that was done 5 years ago.
Oh yeah, absolutely. And it's progressively gotten easier, and it's going to get even easier, I think. It's going to get even easier. There's going to be new tools. I honestly think the way that we're doing healthcare today is not how we're going to be doing it 5 years from now. That law of exponential returns just keeps doubling every year and a half or so, and so we'll be dealing with completely new technologies. There's Google Glass coming out. I can't wait to buy that, by the way. I'm going to be the weird guy with the glasses in the front of the car, absolutely. But yeah, I love implementing new technologies. Try to stay ahead of the curve on that stuff. But anyways, hospitals are going to change from that perspective. People are going to be able to lead surgeries from distance.
Right.
You know, they can already do similar things we've seen. Yeah, sure.
My brother-in-law.
Oh, is that right?
Yeah.
So, but yeah, there's already some things implemented, but it's going to become more mainstream. It's going to become, a little bit more price appropriate for hospitals. Hey, well, let's go ahead and invest in this remote healthcare management. Again, it's going to reduce costs.
Absolutely.
It's going to increase access
And efficiency.
But it also improves the healthcare. So when we look at it from this perspective, your physicians are going to spend more time, your nurses are going to spend more time with the patients.
Right. The patient safety and the quality features of, you don't have any more, I can't read this, what does this say, I can't read this provider's handwriting, or duplicate ordering of tests because one doctor's writing on one sheet of paper and another doctor's writing somewhere else on another sheet of paper for the same patient. So let's say the patient gets 2 CAT scans and it's just a miss. Right now in the electronic world, if a provider's trying to enter orders, their duplicate pop-up messages will come, and there's just so many safety measures and so many benefits to the patient to do electronic documentation. Stay heart healthy. Well, I have a 3-year-old and a 3-month-old, so I do elliptical a lot. It's easy on my knees. I walk quite a bit at the hospital. Usually around lunchtime, I do a couple laps just around the hospital the first 15 minutes of my lunch break.
Oh, that's good.
Besides that, keeping up, it's definitely a challenge, but I think that no matter how busy we get in our personal life, professional life, we always have to make time for that. I remember I was on a conference call with our CEO and she was so winded, and I said, "What are you doing?" And she said, it was 5 a.m. She said, "This is the only time I can do any exercise." So I get up every morning. So even the CEO of our hospital gets up in the morning, and just like everybody else. So no matter how busy you are and whatever the excuses are, I think that it's important to maintain that.
You're finishing a master's degree now.
Right.
Is there going to be a PhD in the future?
It's difficult to ask that somebody 4 classes still ahead of you, but I think that furthering your education in any way, whether it's certifications or formal degrees, online programs, brick and mortar colleges, anything that you decide to do makes you more marketable, makes you stand out, better, more. I started out with an associate's degree in nursing. I decided I'd go and get my BSN and be done with it. And the truth is, in healthcare and in everything, education never stops.
That's true.
And you should do it to the best of your abilities.
I want to have your mom come over and visit with me.
Yes.
I would love to have your mom come over and visit
Mom
with
to
me.
visit.
Yeah, I'll send her an invitation for sure. We'll definitely tell her I'd like for her to
Yeah,
come
I'll
over
bring
and
her
talk.
over one day.
I'm sure she's got some stories.
She has lots of
I'm
stories.
sure she
So
has some
much
great stories. Yeah.
experience.
Well, I don't know if the conversation will be exactly the same. I think I want to dig into the history of nursing. She's probably seen a lot of changes in
She's
nursing.
so much. I mean, from when medication, when I was first became a nurse, we wrote on paper and our medications were locked in the cabinet. My mom remembers when you wrote on paper, there was very little, everything was in a glass bottle, there was no IV bags.
But it's been my honor to have you come over and spend some time with me. Really appreciate it, and I hope that we keep sending people over to
Absolutely.
Bayshore for you guys.
Yes.
Keep them CPR certified.
Yes.
Keep them saving
All
lives.
their ACLS and PALS, BLS.